Peace be to you all. Assalamualaikum. This is Omar Abdul-Malik, physician associate, health educator, and moderately fit middle-aged endurance athlete. So I'm doing a pre-workout or a pre-work workout today. So today's my my indoor workout. So I do some curls, bench presses, and I've got a treadmill, rower, assault bike, a what is this thing? Speed bike, exercise bike, and then you see the background here. I've got my stair climber. Oh yeah, my wife just got off it, so a spinning bike. My basement's a mess. We're having it fixed up, Lord willing, inshallah. So I just wanted to tell you guys about the importance of being physically fit as a healthcare provider, in particular a hospitalist or an ER clinician. One of my duties as a hospitalist PA is to be involved in codes. So that's when somebody's heart stops and you're doing the chest compressions and shocking them if need be, pumping them full of epinephrine and all that other good stuff that can help keep people alive. The stuff you see in movies and those hospital drama TV shows. But I do that. So in order to do good deep chest compressions, you got to do them for 2 minutes. So imagine doing push-ups or doing push-ups against the wall for 2 minutes. I've seen a lot of people, their chest compressions start to decrease in efficacy. But if you're not doing good deep chest compressions, it's not pumping. It's not pushing on that left ventricle of the heart to get the blood flowing through the body like it needs to be. This is in the case of somebody who is their heart stops. But a lot of people stop doing them well after the first minute because they don't have the endurance. They don't have the physical endurance. And then sometimes we have to lift patients. Some of our patients are heavy. Our heaviest patient was a little over 700 pounds. But we typically have patients in the 200 to 300 pound range. So they're difficult because sometimes you got to lift them up to put a board under them so you can do good chest compressions. It's very difficult if you're not physically fit. You can hurt yourself, strain your back, pull your shoulders, and that kind of thing. So you got to be in some semblance of good physical shape. And then if you're running up and down the hospital wards, where I did my training, DC General Hospital, sometimes we'd have to run up and down the steps, if we were on the floor, say, and you had a major trauma in the trauma bay, you got to run down the stairs. And sometimes to get certain supplies that might not be in the trauma bay, you have to run up the steps to a supply closet or something like that. This takes physical conditioning. So that's a big reason to be in shape if you're going to be a clinician. Also, just to be a good example. Now, I want to be a good example. I'm in my 50s now. A lot of black men got morbid obesity, poorly controlled type 2 diabetes mellitus, hyperlipidemia, poorly controlled hypertension. So it's this kind of metabolic syndrome that we're talking about. But there's a lot of us with it. As a clinician and an educator, I want to be a good example. It's not enough for me just to preach. Yeah, get in shape, brothers. Or even if you're not a brother, still stay in shape. I got to be a good example for this. Okay, that's it for now. I wish you guys the best of success in your positive endeavors. Remember, try to keep a well-balanced life, physically, mentally, and spiritually. I wish you guys the best of success in 2022 and beyond. Take care. Peace. If you have any questions about becoming a PA or a health educator, or just living a positive lifestyle, please feel free to subscribe to my channel if you want, or you can reach me on Instagram. Take care. Peace.